Good afternoon, everyone. I'm Kate Kite, Continuing Education Coordinator for Illinois Heartland Library System. Welcome to our Libraries Transforming Communities, Accessible Small and Rural Communities Grant Winner Panel. This grant is awarded through the American Library Association with the purpose of small and rural libraries developing projects that increase accessibility to people with disabilities. Today, we have 4 of our Illinois Heartland libraries joining us to talk about the projects they're implementing. I hope you'll come away from today's webinar inspired by these libraries' initiatives and empowered to apply for your own grant. First, we'll hear about the Transforming Communities Accessible Small and Rural Communities grant from Samantha Oakley, Project Director for the Public Programs Office of the American Library Association. Then we'll hear from our 4 member libraries. Vicki Carr, the Director of South Macon Public Library District, Nicole Lauco, Director of the Millstadt Library, Ginger Newingham, Director of the Athens Municipal Library, and Denise Brainford, Youth Services Director, Rochester Public Library District. Before I turn it over to our first speaker, please note that we will be saving all questions and answers till the end of the presentations. Please ensure that you are muted and your camera is off. If you have any questions during the presentation, please don't hesitate to put them in the chat. I will be monitoring the chat and moderating the questions at the end. This panel is also being recorded and will be available for viewing on our IHLS YouTube channel. So thank you all again for joining us this afternoon, especially our speakers. Thank you for sharing your projects. And now I'd like to turn it over to Samantha Oakley, Project Director for the Public Programs Office of the American Library Association.
Thanks, Kate, and thank you everyone for joining us today. As Kate mentioned, my name is Samantha Oakley. I am a project director with the American Library Association's Public Programs Office and the director of the Libraries Transforming Communities Initiative, or LTC for short. I am so pleased to be able to kick off today's session with several of our Illinois LTC Access grantees. For those of you who are unfamiliar with LTC, it is an ALA initiative that seeks to strengthen libraries' role as core community leaders and change agents. For the past 10 years, it has reimagined the role libraries play in supporting communities. Libraries of all types have utilized free dialogue and deliberation training and resources to lead community and campus forums, take part in anti-violence activities, provide a space for residents to come together and discuss challenging topics, and have productive conversations with civic leaders, library trustees, staff, and the community. Over the years, LTC has had 4 different phases. The most current phase, and the one that we're highlighting grantees from today, is LTC Accessible Small and Rural Communities. This grant seeks to provide financial support, community engagement training, and accessibility resources to small and rural libraries to help them better serve people with disabilities. Through these grants, ALA strives to increase the accessibility of library facilities, services, and programs for people with disabilities in small and rural communities, and support libraries' community engagement efforts by providing resources to help them to work with impacted populations to guide improvement of library services. This phase of LTC is offered in partnership with the Association for Rural and Small Libraries. Grantees are required to identify the disability community they are hoping to reach, so children with autism, community members who use mobility devices, etc., and facilitate a community conversation with them in order to guide improvement of the library's services to better meet their needs. To date, this phase of LTC has distributed a total of $7 million in grant funding to 465 small and rural libraries. Libraries that received the grant were selected through a competitive, peer-reviewed application process and include public, academic, school, and tribal libraries representing 46 states and a U.S. territory. To support their projects, the selected libraries received a $10,000 or $20,000 grant, virtual training to assist in developing their community engagement and disability service skills, a suite of online resources developed to support local programs, including template press releases, social media messaging, logos, and more, copies of the books library programming for adults with developmental disabilities, and serving patrons with disabilities, perspectives and insights from people with disabilities, and a physical toolbox of materials that include stickers, bookmarks, postcards, signage, and copies of the LTC facilitation and practitioner's guides. However, if you are not a grantee but are interested in doing this work, I want to share that we have a ton of free resources available for you that you can download. All these can be found on the ALA LTC website, which is ala.org/LTC. But I've included a slide in my PowerPoint deck with direct links to the resources that I'm going to briefly mention, and I'll share that with Kate so that she can share that out with you after the session. A few resources available that I'm going to highlight really quick is the free asynchronous facilitation e-course. This e-course introduces library workers to the basics of leading conversations. It takes about 4 hours to complete, and you can do it at any pace that you'd like. It's always available for you to access and work through at your own pace. There's also a related facilitation guide that's free to download on the website. And expanding on the skills that you learn through the facilitation e-course, we also have a guide on how to lead accessible conversations available. Plus, we have a practitioner's guide focused on providing tips and best practices for serving patrons with disabilities that you can download. While these resources were all made for a small and rural library worker audience, most of the information would work for libraries serving communities of any sizes. I encourage you all to take advantage of these free resources and many of the others found on the LTC website. In addition to the ones that I just mentioned, we have a suite of webinars, conversation models, and other handouts and resources that you can access. Also, please mark your calendars for September 2024. If you are a small and rural library, round 3 of the awards will be opening then that month. We will start accepting applications, and we are looking to award another $3.5 million to up to 300 small and rural libraries in this round. We will also have a 4th and final round in September 2025 that we will offer another $3.5 million out in that round. So please, please, please apply if you are a small and rural library. We really want to help as many communities as we can with this. And with that, I'm going to turn it over to our panelists.
The Methodist minister, Reverend Terry McDermott, sat on the committee along with myself and my assistant director, Lori Nixon. We met, we discussed ideas, needs, wishes, but we decided to keep it simple. Access, access, access. That's what we wanted for our patrons, for our core group. Still meets and discusses the needs and ideas, and I can see this group being a continuous part of the library's makeup. We come up with ideas all the time, and we try to make them happen. We have a list of things that we are excited about that we're currently doing, and ideas of wishes, things we wish. We hit on the following. We wanted the 3 Ps: practical, programming, and partnerships. So with practical, we expanded our large print. We expanded our audiobooks. We purchased CD players, and we bought memory kits for our patrons with dementia. With programming, we have started a book club. We've started exercise classes to help with mobility. And we also have formed so many partnerships. It's amazing when you talk to people and you tell them the ideas you have and the things you want to do, you find all kinds of stuff in your small areas. Excuse me. We partnered with the Macon County Health Department. The Starting Point is their subgroup, I think, under the Macon County Health Department. Of course, our senior citizens group here in Macon. We also have worked with the U of I Extension Office and with our South Macon Fire Department for other ideas and things we need. This is just a picture of the library, and we've expanded our large print. Now we practically buy mostly large print because everybody can read large print. These are our memory kits. Sorry, got choked. And we are really excited about them. We've had a lot of interest. We also have some books for dementia and people that are caring for their loved ones that have dementia. We have a large senior population, and that has really hit home with a lot of people. And then this is our Aging Actively fall prevention group. We had a huge turnout for that. And I mean, they're faithful. They were meeting once a week, and now they have asked us if we can expand it to twice a week. So now they're meeting twice a week. Um, so we have learned a lot, and we continue to learn a lot. And we have a core group of vested people in our library and the services that we offer. And we plan, we want to make all of our patrons feel welcome, to make our library the hub of the community. And with this grant, we were able to address so many needs and struggles that we would never have been able to otherwise. And that is my presentation.
Thank you so much for sharing, Vicki. I greatly appreciate that. I really liked hearing what you implemented in your library. So next up, we're going to have Nicole Lauco, who's the director of Millstat Library, share what her library is doing with the grant.
Hi, everybody. I'm going to go ahead and share my screen. And yeah, I'm Nicole Lauco. I'm the director of the Millstat Library. So I've been here about 7 years now. For those of you who don't know Millstat or aren't familiar with it, we're a rural village located in St. Clair County. We're in between Belleville and Columbia and about 30 minutes from downtown St. Louis. Our 1,500 square foot building was built in 1969, and the space now serves double the population at around 4,077. We mainly serve a middle-class Caucasian demographic, and the majority of our patrons are seniors and young families. I'm the one full-time employee, and then we have 3 part-time employees, and we operate on a budget of about $140,000. Through my years here, I've been spending it increasing programs, our visibility, our inclusivity, and just improving our reputation. So for our grant, it all started kind of like with a team, because like all good things, they can't be accomplished alone. In fact, many of them probably wouldn't even have been thought of alone. That's the case for our grant. A few years back, we had sent out a community survey and had a response from a parent about how they would like the library to accommodate those on the spectrum better. And a few conversations later, we learned that this patron not only had a child on the spectrum who had also had some bad experiences at our library, but also worked at the Illinois Center for Autism. This gave us a great start to get more sensory-friendly programming and think about how our space can serve our community better in that regard. And that patron has been someone to continually reach out to. During these conversations that we had with that patron and the implementation of some of these more sensory-friendly programs and ideas, we continually cross paths with another parent, and her name's Kelly. And she also has a son that's on the spectrum, but she has been going a step further and working on different autism things in our community. So she founded a Millstat Autism Awareness Foundation and hosts a yearly autism walk to bring awareness. Kelly has been a great supporter for us at the library and an advocate for those on the spectrum. And she brought the idea to have autism-friendly businesses into our community. So we had an orientation and certification with Kelly, her son, and her husband, and her son's behavior analyst, Lauren Bem, of Trinity Services and Abilities. So when the LTC grant became available, I already know who to talk with about grant ideas. And actually at a Millstat Autism Walk volunteer meeting, we talked about funding ideas. And many of the parents there were frustrated with the cost of classes and how far away many of those classes are. In Melstad, it always feels like everything's about an hour away. And then I pitched my idea for classes to Lauren. And when we got the grant, she was able to help us get the ball rolling to bring more education to our community. So overall, we already knew what we wanted to be able to do, which was serve our community better and more accessibly. Our main focus was to implement classes. However, if we were awarded the $20,000 instead of the $10,000, we wanted to spend some additional funds to get an accessible door and to replace some of our carpet to something more friendly. Everything has gone well so far for our initial plans. We have done just those things, made our space more accessible, and created an online resource page with information on libraries and the recordings of the classes we've hosted. In short, our grant process really followed just some short, important steps. So one, we reached out to the community members who have family members on the spectrum. We spoke to a few professionals. We got a quote from several accessible door installation companies and even some contractors. We did our budget based on the best costs we could allocate. Conversations beforehand really helped us to have actual numbers to budget. Even though we also knew what we wanted to do for the grant, we didn't know the finite details, like what classes, what dates or times would work for our community. So we worked with Lauren's expertise and came up with a survey to go out to our community. And then we leveraged Kelly's contacts with the Autism Walk volunteers, and we were able to use the Illinois Center for Autism pages from our other patron to help spread the survey and the information. So, and then with all the information we gathered, we started to plan our classes, and we actually had a real renovation on the way, and I'll get to that in just a bit. So, like all of the community surveys we've ever done, we kind of tried to keep this one very short and simple. It was about 20 questions, and they just were very, very basic. Would you be interested in courses to help you care for those on the spectrum? Would you prefer these classes online, in person, or both? Most of the questions we asked were actually about the frequency and times of the classes. And as you can see, well, we had also the most important question we asked, which is what courses would they be interested in? This really helped guide us to figure out what our curriculum was going to be. And mental health in general was the most popular, with behavior basics coming in second. And these classes, they do kind of gear more towards younger people, so a lot for parents, maybe caregiving to children, but they could be easily adapted for older audiences. I personally see a lot of similarities between this and caring for an elderly person. So, of course, a renovation wasn't part of the grant, but what was great about with the grant's timing is we needed to do something to our space. We've been trying to build a new library, but as for right now, what we need to do is make the space that we have work. So what was great is we were able to leverage this upcoming grant and build a more accessible layout for our library. And that was through, making sure we had calming colors, getting the new plain carpet, open-ended aisles, and an accessible door. So this is just kind of more of our actual change of space. And although we only asked with carpet costs and the door and some signage and light covers from the LTC grant, it really helped us to stretch our budget to make a more accessible library. And then our classes, we've hosted a few classes already. Just last week, we had our mental health class. And all except for our class for small businesses that we hosted with our Chamber of Commerce. They're recorded and available on our online resource page so that families and community members and anyone else can view them as they need to. We have also come up with a schedule all the way up to September so people can plan accordingly for the classes they would like to attend. And then, yeah, with the success of round one, and we kept getting emails to apply for round two, we're like, you know what, let's go ahead, let's give it a try. And we did apply for another $20,000 grant to continue our classes and to install a sensory garden. We were awarded the $10,000 grant, and although we only had planned to continue classes, we did find that we could afford a sensory garden along with that. However, our local park just has finished installing a sensory garden. So now we can't see the point to have 2 in our community. We're not that big. And so that's what surveys are for. So we're fine tuning the last details on our survey, and we're going to find out what our community wants in terms of additional resources, classes, or services that are going to meet their needs. And we hope to have our community meeting at our next class in May. But of course, we've always got successes and challenges with all of these. One of my favorite successes is any time that we can speak with our community and receive their input. It really makes anything a success. We love getting to hear from the people who knew what they actually needed. Installing the accessible door has been a great asset, especially for our elderly and disabled populations. The door is extremely heavy that we have. And then we were able to bring the classes to our community, and that's had a positive impact. And the resource page we have is going to be a great asset as it grows. And the main challenge we have weren't really any different than what our usual challenges are. And that's just getting more survey responses and more people to attend classes. We've been trying different promotional avenues to better advertise, so we'll find something that's going to stick for us. So the last thing is I just wanted to give some takeaways to anybody that might be looking to apply for a grant. I always say stay talking with your community. It's so important. So when you're out in your community and you're meeting people, keep track of them, know what they do, maybe, be friends with them on Facebook. By doing so, you won't be at a loss when a collaboration comes up. So like for the LTC grant, I already knew who to reach out to find some ideas for this grant. And just like too, you always answer every question. Even if you don't know the exact answer, be sure to answer them as completely as possible. Just like with your budget, you might not know exactly how much you're going to spend on promotions, but you can do your best estimate on average ad costs for what platforms you're looking at to do your promotionals on and put that in as a placeholder. And you've got to be flexible. LTC grants especially, and this is what I love about them, they really allow for your community to dictate your project. Be sure to go in with it knowing your main goals, like improving accessibility for a certain demographic. Like in our case, it was primarily focused on community education for the parts of our community that were patrons on the autism spectrum. But we also had to keep fine-tuning our grant to meet the needs of our community, like which classes we were going to have. So I think it's just finding that flexibility with your goal. And the biggest one is apply. If you have the ability to take some time out of your day to apply for a grant, do it. It helps you keep up your skills. It helps you to try to bring something new to your community and your library. And in some cases, you actually get to win a grant that will benefit your community. So yeah, thank you all. My information's on the left. Our resource page, if you want to check it out, is right there. And then the website for Trinity Services. So thank you.
Thank you so much, Nicole. And if it's all right with you, I'd like to share at least the link to your website resource page with everyone after this.
That'd be perfect. Thank you.
And then now we'll hear from Ginger Newingham, the director of the Athens Municipal Library, and what their library is doing.
Okay. I'm so proud of you for calling it Athens and not Athens. All right. Okay, like I said, I'm Ginger, and I have been the director at Athens Municipal Library since 2020. And we have a town population of 2,000. We're, like I said, municipal library, but we service a much larger service area. We're north of Springfield here in Illinois. And this is just more information about our grant and how we are spending it. We saw a need in our community. It starts actually a little more personally for me. I have 2 adopted kiddos with special needs, and before becoming the director here, I would bring them into the library, and I actually left from an event one time, and one of my kids had disrupted it. He's on the autism spectrum. And I felt very discouraged that the library was supposed to be a public space for all, but it definitely was not accommodating, welcoming to my son. And so once I started working here, I worked to change that environment in any way possible. And when this grant opportunity came up, I thought this is totally in my wheelhouse. So I want to tell you too that these pictures that I'm using from patrons in my library, I have permission to share them. So just so you know, but these are some of the patrons in our library system who have special needs. So we're trying to meet their needs and help them. So the audience for what we applied for was to help the families of children with special needs and disabilities. So obviously that's going to include resources and things for the children, but we especially want the families to feel comfortable, because if like me leaving an event, if I am not comfortable there bringing my child there, then I'm not going to return to the library. So we wanted to be inclusive for these families. Our school district currently reports 177 children who have IEPs, and then another 22 children who have 504 services. So that's 19% of our entire school district. Obviously, there are families of children with special needs in our area, and we were awarded the $20,000. Just like everyone else, we had to start with a community conversation. We gathered a group, and we took this as like an open invitation to invite anyone in our community to come and to talk about maybe just issues where Athens is not able to service or meet the needs for the children in our area who have special needs. So we specifically, like I went to the city council and invited them specifically to come and join. We invited teachers, I specifically contacted parents of children with special needs that I had information for, or who are in the library. I would hand them a flyer when they would come in to check out books or whatever. So we really tried to play up that anybody and everybody could come and have a voice and be a part of it. The other thing that's probably a little bit unique about our community conversation is we offered a buddy system. So we partnered with the National Honor Society here in town with the high schoolers, and they came and brought, I think, 15 students. And so any children that we had that came that had special needs, their parents could fill out a child info sheet, and then on the back of it had a little kind of checklist of things they could do while here at the library. And the National Honor Society students received a quick training, and then they would buddy up with these kiddos. That actually was very successful for us. We had the largest demographic represented in our community conversation. That was parents of children with special needs, and so that was great to see those kids buddy up with a high schooler and have somebody who is sort of watching out for them. The kids would sometimes come into the meeting because our meeting room is right off the side of the main library, and that was fine. But this just gave them an extra set of eyes on them, an extra set of hands for assistance. And it worked out really well for our meeting. So we had parents come, we had a dyslexia tutor, we had some former teachers and foster parents. So it was a good mixture of people who came to the community conversation, and they gave great feedback with our budget and what we planned to spend our money on. So I'll get into that now. I feel like rather than having one large project or purchase item or whatever, I broke our budget down to the dollar. And so we have multiple areas of disabilities that we attempted to address. And within those, we have just certain small little purchases that we have been making to just increase the usability of our library for these families. So specifically, I'll go through some of those. We're purchasing Wonder Books. We purchased headphones for our iPads, our computers, some of our other to send home with the Wonder Books as well. So communication, we're purchasing the PEX. It's like a digital iconographic type sign making so that we can print out a social story for children with autism or, you know, anyone who struggles with transitions that can be printed and hung up, and it explains like the steps of what you do at the library. We worked on for emotional support. We're posting that we do allow service animals in here. We have purchased the baskets, the rolling baskets, the wheelchairs, and then the front displays so that those who are in wheelchairs have an easier time seeing some of the books that are on display. Right now, currently our books are displayed up on the top of the shelves, and many of the kids that come in wheelchairs cannot reach or cannot see those. So this allows them to be at a lower eye level for them. One of the things that we got a lot of feedback on during our community conversation was the adult changing table. So we have not yet ordered that, but we are working with a couple different companies to get quotes. Just the people who had children who could utilize those had some feedback and specifics that they requested. And so that was fine. That was a great, just a great conversation back and forth with those people. We've purchased quite a few sensory items. We have a wall display that has sensory input for the kiddos. And then we also have sort of revamped our story hour time to be very sensory friendly. So there's a lot of different activities and things that we do in between books or during books or whatever that are all utilizing these sensory items. We are finishing up some purchasing right now of large print books and then the Kindle Paperwhite so that we can specifically have training in that like a packet to check out the Kindle Paperwhites, but then we have training on how to change the font in the books in order to be the open dyslexic font. And then sort of at the end of the grant, whatever money we have left over will all be used to purchase books about disabilities. So whether that be with main characters who have disabilities, whether it be resources for parents, or whether it be my brother has autism and like a nonfiction children's book. So this is our summary. Like I said, we tried to hit multiple disabilities just to help bring those families in and help them be comfortable in our space. And then here's some of our results. These are some of the kids using, some of the kids actually featured in the very beginning of my slideshow, kids with disabilities who are now using the sensory wall. And then doing some checking out of the books and using the large print books. So we have challenges, I think, like the other two have said as well. Small library, small staff. This is a long shopping list. So lots of ordering and kind of ordering and then processing books and cataloging books and things. All of those things are just sort of happening in small pockets of time. So that's been our biggest challenge. But we are seeing the community step up and really utilize the library. I actually realized in story hour the other day, which it was a pretty full story hour, that we actually had more kids in the story hour with special needs than we did who would be considered neurotypical. So we're definitely seeing a major change in our community and the shift in the way that the library is being used. This is just a QR code I threw at the end in case anyone wants to see our budget, and then what we handed out, that form that was given to the parents to fill out for the kids and for the buddies and everything like that. So that's just available for anyone who would like it.
Thank you so much, Ginger. And remember, if anyone has any questions, keep those in mind because we'll ask them all at the end. And we will turn it over to our final panelist today, Denise Rainford, Youth Services Director for the Rochester Public Library District.
There. There. Well, welcome. Thank you for staying and learning a little bit more about how we're using our grant money. So, one of the things I really liked about the LTC grant is how much information they gave us to start with, such as over here in our nothing about us without us. It really brought my attention to make sure that I am paying more attention to things that I maybe didn't in the past. So the information they gave us, I have just been absorbing it and passing it along. So anyway, our library was built in 1985, and I've been here since 2017. I've been the youth director for since around 2018, and I've noticed for a while that the children that come from the daycares walk straight down the street to get there because there's no sidewalks. And I've taken pictures of it. They sent to the village to ask about sidewalks because that makes me nervous. And I have a sister who was legally blind, and I remember her reading. She's my older sister, and reading to me as a child with her Braille books in the dark. And so I just have always been a little bit aware of people with visual impairment. So anyway, to go back a little bit to our library, we have not had a budget increase in 30 years. And we have 6 full-time staff and 5 part-time staff. So I just thought who in the community could really use our help. And my mind went to young people and the older people because of our lack of sidewalks. So once we decided on that, I thought our goal would be to maybe put the items in those places where those people could get to easily, because children can't get to the library unless their parents bring them. And the seniors often have the same problem if they're not driving anymore. So that's where our emphasis went. And so after we decided on that, I went out and started talking with the Rochester Public School District, and I met with the director of special education, and she was terrific, and I relied on her heavily as far as what items the school could use. And then I talked also with Carriage Crossing Senior Living, what kind of things that they thought they could use. And this was all just for writing the grant, because I hadn't had a community conversation yet, because I didn't know there was such a thing. Because this is the first grant, I should say the first major grant that I've ever written, that gave us so much extra information. And so I guess I'm saying, apply for a grant, even if you think that you don't know enough. Put down exactly what you do your research and put down what you know, and the grant, the people that run the grant will help you along the way. So my process was, as far as planning, was to look at our demographics and figure out what we needed. That is the most tedious part for me, is looking at all the numbers, and it's also harder for me to consume those numbers. So I decided to use an infographic, which is easier to consume, hopefully for the people who are reading the grant as well. And then I made the connections with the outside, with the school and the senior living. I also went out to the education for the visually impaired and asked her opinions on what kind of things would be better for the visually impaired. And then we identified the items using our outside resources that that I found. And then after we identified the items, I created an MOU, mutual of understanding, with both the school district and the senior living community. The MOUs, you can find them, sample ones online, and then you can create, adjust them to meet your needs. And then we got to start purchasing items. Luckily, our items came around, when I started purchasing was right around Christmas, so we got to use Cyber Monday. And just a FYI, that's a really good time to get some deals on the items that you had on your list. So, and then our end was the delivery process. And I'll talk a little bit more in a later slide about how that went. And some of the things I had delivered right here to the library, some things I had delivered to the school. And then we worked on documents together so I could see usage of the items. I also wanted to point out all the pictures I've had so far. The first one are of kids in our community, or seniors in our community that are using the items. These are the wobble desks that we purchased for that they sit on the desk, and then that gives the support to the desk in front of them, but they can rock on it and wobble in all different directions, and kids love them. So as far as our staff involvement, we have been working on a DEI statement, and we have expanded that DEI statement now, especially with all the webinars that have been offered through ILA and Youth Academy and the ALA. So our staff is educating themselves, we're educating, I'm educating myself, and then we also explained to them clearly what the items were and where to find them, because we actually created more towards what Ginger was saying, items that are used in-house in the library that will help with kids with special needs or neurodiverse children. So now that our story times, we have fidgets and ear protection that we purchased with the grant. And then just even outside of the grant, I've been aware of some more things because of the information I received, and I've gotten some pop-up tents. And so if kids are having a hard time in the library, we can pop up a tent and give them some fidgets, or we can even during the story times if they need to pop up a tent or just use the fidgets. So it's really helping us as a whole library be more sensitive. This here is some of the items that we have purchased. It is not an exhaustive list, but it is some of the items. One of the ones that has been really popular in the teen area is this weighted axolotl. These are all seniors, and the items that we have purchased for the senior living plan. This young man is using a pen that speaks and will read words for help with dyslexia. And this is a signature guide that we leave up at the front desk. I created one for our library, as well as the senior living. And it has a signature guide that you can put over the paper so they know exactly where to sign your name. It has a Sharpie and then a light up magnifying glass. That was something that was suggested to me by the education for the blind here in this area. And the other thing I was really excited about is this kit here on the right. It is a guest room kit. So if you have a family member or a friend that has that is hearing impaired or visually impaired, this is a kit that you can check out just for the weekend to make it easier for them and you to communicate and be able to see when the door is being knocked on. or here. So we're really excited about that. Application, some of our successes have been our community conversation. That went really well. We got feedback, and from that feedback, we did make some changes in our original plan. Most of the items were still available when we were ready to purchase, not all, but most. And again, I said the Cyber Monday thing worked out quite nicely. That actually saved us a few $100s. And it also brought more awareness to being cognizant of other needs. Now, what I mean by that is the surveys that we put out. It helped us realize, helped us know that where we needed to help educate the community. And what I mean by that is we have a couple of responses that said, we don't have any visually impaired people here in Rochester. Well, I'm wearing glasses. Many other people wear glasses. And so that just made us aware that we needed to help educate the community of the need, and that they might not have a need in their personal family, but other members of the community do. So I really appreciated that part of the surveys. We did get 73 responses, so I was really happy with that. Some of our challenges, we had a little trouble with the senior living, the follow through as far as our community conversation, attendance, and I was a little sad about that. So through the conversation of the people that were there, we decided to adjust our spending and add more items to the library itself and to the school, and we reduced the amount that we were spending at the senior living community. We didn't cut them out, but we just altered the plan a little. And then the other thing that I hadn't thought of is when the items that I thought that I had delivered to the school, I asked them to check them when they received them. We thought it would be easiest to have them delivered there. They told me they were in good shape. However, when I went over to help, they hadn't opened anything. So I think if we ever were to do something again, I would have everything delivered to me, and then I would do the delivering, because there was an item that was damaged, but because they didn't open the box and find out that it was damaged, the item couldn't be, it had passed the date of having the company take care of it. So the school did take care of that item themselves and had the part replaced. And so, yes, I also had a damaged item here at the library, but I sent the information the day that we received it, and the company had no problems replacing the item. Shipping costs, be careful on that. Most of the places that I asked for quotes were very good about just adding the shipping into it, but there was one that did not add the shipping into it. So that, so beware of that, be cognizant of that. And also, I was shocked at how much shipping was for certain items, like the shopping cart was almost as much as the shopping cart. So it was just a little surprising. So be aware of this hidden costs. So these are just some links to our different, some of the things that I added during the application process. This is an infographic of that I sent that gave the information about our community and about the programs that we do and the students that have disabilities. And there is also a copy of the MOU agreement. I'm not going to open it, but if you would like to, I can send the slides or the links. This is a link to our survey that we sent out. It was not long, but it was a visual of how many people that took the survey that were living in our community, and what their usage was, and asking about the household, how many of you live with a household disability. I liked this one because it showed that there is about a quarter of the community that has someone living with a disability. So again, if you would like a better look at those are things that I could send to you. And yeah, like I said, it has just really brought my attention to looking at not just people, because I have a person in my family that have a visual disability, there are many other people that have other things that you can't see. So it just really has brought my attention to being aware of other people and their needs, not just your own. And just also how I'm marketing it. I will have to say, I love this new logo that I found with neurodiverse images and all the different types of disabilities. The only thing I would like to find out, and you just put this in anybody's ear, is there are new signs of with wheelchairs where people are, they're moving it themselves and it looks like they're moving forward. And I would love to have that one with these signs along them, but that's just an FYI, just if anybody knows of one, I would love to have it. And these are partners, the special education director and the executive director for senior living complex. Our library already has so many more ideas that have blossomed off of this grant. We're so thankful to have received it, and I think our community has as well. We also just finished. I did another community conversation just the other day because I wanted to know how people were feeling and if they knew about it after having gotten things in place. Unfortunately, it was a really bad weather day, storms, and we did not have a turnout, but we were able to broadcast it live on Facebook. And I have had some few surveys answered online. That's thank you for listening.
Thank you so much, Denise, and thank all of our panelists. One thing that I find so amazing is that you took like the same grant, the same grant application, and have 4 different projects that are meeting different needs in your community. And I absolutely love that. I have a couple of questions that came in through the chat, so I'm going to go ahead and ask those. And then if you have any questions, please put them in there. Kathleen asks, Nicole, how do you go about surveying people? Did you send out forms, set up iPad at the circ desk?
Yeah, so usually when we do any surveys, we just do a Google form and then we share the link, and that can just be on Facebook. Like in this case, we had access to other people that could share it in groups that we can't. So we just made sure that those members of the community had access to it. There are other things like we've done before where you make it into a QR code and put it on the door, take it around to other businesses and set them up, even at restaurant tables if they let you. But yes, for this one, we just sent out the link.
Thank you. And then for Ginger, we use a metal rolling cart, sort of a utility cart for our older patrons to use to put their purse and also put their books on. It is quite sturdy, and I think it would be useful to younger patrons with balance issues as well. So I guess would that be appropriate to help younger patrons with balance issues?
Yeah, I'd have to do some looking into that, but I like it.
Thank you. And then I have a question for Vicky, and I apologize if you mentioned this, but your memory kits, did you purchase those as a kit? Did you build them as the library? Did like a neighbor or a community care home or anything help with that?
No, we purchased them through the company that was on that slide mentality. And they were all put together, everything together. We did quite a bit of research into it. Judy Wise, the senior group leader, myself and a couple others, we looked at what there was to offer, and then we looked at, putting them together ourselves. And the lady at this company, I think I know it's a very small company. She was so helpful, and she said, anything we want to copy, we're free to copy it. The cost was, I think, I think $90, $99, somewhere in there. And it's all put together. It's in a backpack. It's all, one thing. And they're really neat. They really are neat. So, yeah.
Awesome. Ginger, you mentioned that students in your district had IEPs, but then also needed 504 services. I'm familiar with the individualized education plans, but I was unfamiliar with the 504.
So the 504 is just a less formal, like educational assistant. It's if a child still needs some sort of support, but maybe they don't require a full IEP. Maybe they don't have a diagnosis or, whatever, but maybe they just need modification in their seating at the cafeteria table or something like that. So they're obviously receiving some sort of services and supports in meeting their educational needs, but it's not quite as formal and usually is overarching as the IEP.
Thank you. And then Denise, there was an item on your screen or your slide that had all of the equipment. It was down at the bottom between like a walker and what looks like a Walkman kind of kit. And I was curious what that one was.
Okay, yeah, I think I know what you're talking about. It's, let me share my screen, maybe we make sure we're looking at the same thing, if that's okay. This red one here.
Yeah, I think it was red.
Okay, so that is a pager system that the nurses asked for. They some kids need to have medicines at certain times, or if there's a fall, they have a tendency to fall. It was just a way for the nurses to be able to get to people that needed it as quickly as they needed to.
Okay, thank you. I could tell they look kind of like buttons and like large buttons.
It's a pager system. Yeah. The kids would keep one with them.
Yeah. Does anyone else have any questions? I think you all did an absolutely fabulous job giving an overview of your projects. I wrote down more things that I loved about what each of you are doing at your libraries than any questions, because you did such a great job. Like Vicki, I absolutely love that you've really upped the large print, because as you said, everybody can read that. And I know from my experience, their large print are in demand. And there's just not enough of them, enough copies often.
Right. Well, and we share them with everybody. So it's not just our patrons that are benefiting. It's the whole library system. So, yeah.
Yeah. And Nicole, I loved how you were able to use this grant as kind of the impetus to remodel your library. I loved whenever you showed, I know I visited, I think, before the remodel, but I love how you moved the circ desk. So whenever you come in, you see your friendly library staff faces and you can greet everybody.
Yeah, thank you.
Ginger, I loved the idea of the National Honor Society buddies. Like even before you went into that more, I was like, that is an awesome idea. And I bet everybody had a great time. I was going to ask.
Some of those kids now are babysitters for some of these children who showed up.
Yeah. And I was going to ask, do you have kind of like a volunteer program at the library? I did see the one young woman behind the counter, like scanning books. Is that kind of something that you offer?
So we actually partner with the classroom for children with special needs in our district, and we employ students like through their work program. So that gal actually has worked for me for 3 years now, twice a week. And then we have another boy who has come kind of off and on, but he just graduated.
That's awesome. And then Denise, I love that signature kit. I love that signature kit that you can, and just the wide range of devices and assistive tools that you have purchased.
Thank you. I also wish I had pointed out, and I will now, if that's okay. We pointed out, we got a computer for the visually impaired, and it has talking software on it, and a large keyboard, and even people that have been using it at the library that are not blind, but they love the large screen and the large keyboard for just older people that just need larger things now. So, yeah.
Oh, yeah. We did have a question coming through the chat. We had a coffee talk program today, and one of the patrons mentioned that when they fall, they realize that they can get on their hands and knees to get something to help pull themselves up. Are there any kind of classes that offer other practical tips for seniors at home? So in any of your research for the grant, did you run across, or anybody that's just attending, if anybody has any resources for that, that'd be greatly welcomed.
We partnered with the area DISC, the instructor there, on a fall management class, and that's what started our chair exercise classes. I know that's not at home, but it anything we can do to help with mobility and the ability to be able to take care of yourself and stay home is so important. And then the disc the lady from the disc can't always come, so we have purchased some chair exercise CDs, and we also continue that on because she can't come. They want to do it all the time and she can't come that often. So anyway, that's been so popular. I mean, our room is packed every single time. So yeah, we're really pleased about that. And anything we can help them do to stay home is a great thing. So
Yeah, and I'm sorry, will you repeat again who offers the fall prevention classes?
We did it in partnership with the DISC, which is DISC, and it's in Decatur. And they the lady's name, I'm sorry here. Let's see, I have it here. The lady's name is Tracy Witten, Witten, and she's out of Decatur, the DISC, and we did it in partnership with her.
Okay. Yeah, because I'd never thought about those classes, but that would be something I'm sure a lot of libraries are interested in, especially as we see our populations aging.
Mm-hmm. Yes.
Okay, well, I don't see any other questions in the chat. I did allow time. I scheduled it till 2:30 today, and so we're going to wrap up. It looks like a little bit sooner, but I wanted to make sure that we had time scheduled for any questions that anybody had. So I, again, will be sending out the recording in the next few days, along with the links. Presenters, if you are willing to share your slides, I can include those as well. And I want to thank everyone again for joining us today. It was an absolutely fabulous time to get to learn about these awesome initiatives you're doing at your library. And I really hope that if, I know that some libraries also received round 2 funding. If you received round 1 funding, real quick, if there are any of our libraries that are thinking about going for round 3.
Yeah. We have a list. Our committee is really active, and they have a list of all these things they want us to do. So we're going to try.
Yeah, that's awesome. And I see Denise, you're going to go for round 3. Yeah.
Yeah, we have some ideas as well. And it's contagious because the school has even started a whole program about lending things to the community on their own too. So what they have started, the ALA has started is spreading.
Excellent. Awesome. Well, thank you all again for joining us today and have a wonderful rest of your afternoon. And I hope to see you all again soon.